Hello, I am Zeela ZAIZAY, the Liberia Country Program Manager, and I'm with my colleague Shahreen, Research Associate on the REDRESS Program, and we will be presenting on behalf of the team on creative collaboration, participatory approaches, and thinking beyond biomedical care within health system strengthening. REDRESS was a full-year research partnership with the Liberian Ministry of Health, research and NGO partners. REDRESS aims to reduce the burden of neglected tropical diseases of the skin in Liberia through person-centered approaches, stigma reduction, and health system strengthening. Liberia is a West African country with just over 5 million people. It is endemic to a range of skin entities. It was the first country to provide integrated case management, which seeks to identify, diagnose, and treat people affected by entities. This was first introduced in 2016 as a pilot across 5 out of the 15 counties in Liberia. The emphasis so far has been on the case detection and clinical management, but there has been no provision of mental health care for people affected by skin entities.
REDRESS used a participatory action research cycle, placing people affected at the heart of research and action design and development. Working along with people affected and other key health actors, such as community health workers as co-researchers, REDRESS first studied the care available for people affected to then identify ways to strengthen holistic care. Here you can see a selection of the various creative participatory methods we used. For example, social mapping to understand and map community structures with people affected by skin NTDs, body mapping and photo voice with community health workers and traditional and faith healers, and these methods really allow participation from a diverse range of actors. The participatory methods were used to elevate and listen to community voices to then inform the co-development of a context-specific intervention in collaboration with community and Ministry of Health advisory boards and through involving people affected and community actors. And this slide really highlights the holistic and integrated intervention components, which included training on integrated case management, mental health and stigma prevention, supervision tools and job aids, as well as the pre-positioning of medicines and laboratory hubs for testing. We would like to highlight how one of the key successes of REDRESS was the cross-program collaboration. Community advisory boards were established and the Ministry of Health Technical Advisory Board brought together different programs to collaborate with the NTD program, including mental health, community health, and supply chain, to mention a few, but you can see them detailed in the illustration in the slide. Please now hear from Emerson Rogers, the National Coordinator on the NTD program, on the strengths of cross-program collaboration.
My name is Emerson Rogers, and I worked with the Ministry of Health. I served as intervention coordinator for the REDRESS research project, and I also served as national coordinator for case management entities at the Ministry of Health. I've had a lot of experiences as far as REDRESS is concerned since the research started. What interested me most was the collaboration among all of these stakeholders, which were very much welcoming. And the most important thing was how successful we were in integrating mental health with entities, and which is really a plus for the program. And as a program, we have officially adapted the REDRESS Intervention Training Manual as a routine training tool for the National Entities Program, to be specific, the case management program. We've evaluated this training tool and we've seen that it has all of the base pieces and components needed to effectively roll out a comprehensive training that will yield results. As we speak right now, I'm currently planning to roll out the training of health workers, community health workers in Grand Bassa County. That has to do that is one of our 15 counties. And I'm definitely going to use the REDRESS Intervention Manual that has been adopted as the routine program training tool, and all of its components that has to do with various forms, the ledgers, the case management integrated ledgers, and all of the indicators that have been built into the HMIS tool. So this is a plus, and we must say a very big thank you to the REDRESS research team. And I think adapting the training material as a program routine, training tool is a form of sustainability for the continuation of this activity.
Co-researchers included people with lived experience of entities and community health workers who were involved throughout all stages of the research process. Please hear now from Emmanuel ZAIZAY, who is one of our co-researchers and lead peer advocate.
Today, I'm okay, and I was selected by an organization called REDRESS, and I'm serving as co-researcher, and it's good I was selected. So people feel happy that at least I'm one of the patient-affected person talking to them, so they feel convinced and they feel encouraged to give me the time to talk to them, or even people who moving with me, they get a trust in us because I'm a very good example of the bereaved others.
This slide highlights the different ways in which co-production of evidence was used for equitable person-centered care and an essential role of persons affected. This sketch of Emmanuel explains how sharing his story encourages others to seek care, and this has led to a network of persons affected by entities. Involving diverse actors such as persons affected and informal providers strengthens case detection of skin entities and builds trust. Persons affected by entities and traditional as well as faith healers were trained as peer advocates on how to recognize and refer persons with symptoms of skin entities. Peer support groups were also formed and provided with seed funding for income generation activities. We will now speak a bit more on how REDRESS collaborated with traditional and faith healers, which often leads people affected to seek care from informal providers such as traditional and faith healers. Traditional and faith healers often hold significant cultural and societal influence in the management of skin entities due to their trusted positions within the communities, as well as the community's beliefs about disease origins. Therefore, REDRESS work with traditional and faith healers to document their day-to-day experiences in providing care for people affected by entities through photo voice methods. The formative research revealed many people experiencing mental illness seek care from informal providers such as faith and traditional healers, who seek to meet this gap through a variety of measures, including trauma healing classes as described by this participant who leads a local church. REDRESS partnered with informal providers to co-develop interventions on identifying symptoms of entities, stigma reduction, and basic psychological support. Training, sensitization, and involving them in referral systems can lead to early case detection and timely referral to formal healthcare settings, thus reducing delays in treatment. Integrating traditional healing practices with biomedical approaches can offer a more comprehensive and holistic care strategy. Collaboration can enhance treatment outcome. Common to both the informal and formal providers were impacts of respect, recognition, and collaboration between the both sectors. An example is the testimony of Hagar, a health worker as well as co-researcher, who shares her experience of mutual collaboration that now exists between them.
And so we would like to end by sharing our key messages for success within the program. Using a participatory approach was key. REDRESS utilized innovative creative methods to understand current gaps from both patient and provider perspectives, and this evidence was generated to shape the co-creation of localized and context-specific interventions for NTDs. As Zeela mentioned, traditional and faith healers are trusted within the communities as they offer holistic care. Training them about NTDs, providing basic psychological support and referral increased case detection. However, challenges such as financial incentives and clear roles still need consideration for effective collaboration. And cross-program collaboration across disease programs are essential. REDRESS work together with the NTD program, mental health, community health, health promotion, and laboratory health departments within the Ministry of Health. Respect and recognition of roles was key to building relationships and collaboration between formal and informal health systems. This allowed each health actor to manage the relevant components of skin NTDs, for example, the holistic and the biomedical. And the essential role of persons affected. Individuals with lived experience of NTDs are powerful advocates and support networks for challenging stigma and encouraging care-seeking behaviours within communities. And finally, diverse actors and building trust. The community and health system involve various actors, including traditional healers, community and health facility workers, and persons affected with lived experience. Training and support and ensuring a robust supply chain can significantly improve case detection and referral and maintain trust in the health system.
I would now like to invite you to visit redressliberia.org and take a look at what we have done over the years. And thank you very much for listening.